Good afternoon. My name is Victoria Bracey, and I'm a student in Professor Intrican's class. And today I will be discussing short staffing in healthcare. Short staffing is a very common issue among healthcare organizations across the United States. Short staffing occurs when there are not enough staff to meet the demands of the healthcare organization's needs. This issue has existed long before the year 2020, but the COVID-19 pandemic has exacerbated the issue in several different ways. By putting a more intense strain on an already fragile system, healthcare organizations have seen a dramatic increase in short staffing in recent years. Short staffing has a significant impact on nursing since there is a large shortage of nurses currently in the United States. When there are fewer nurses working on a shift, the nurses who are working are forced to take care of a higher rate of patients. Their attention is stretched thin and their time is divided even more than usual. Short staffing can lead to overwhelmed nurses who are more likely to make mistakes. This ultimately compromises patient care, which goes against the entire aim of nursing. Healthcare managers can use this information to better address the short staffing situation seen in the United States. One of the most common reasons mentioned for short staffing is staff burnout. By being mindful of the causes of burnout, healthcare managers can take steps to help alleviate the burden when possible. By hiring more staff or utilizing travel nurses, the patient to staff ratio lowers, which allows the staff to more efficiently provide quality care to the patients. Managers can also compare both short-term and long-term solutions to evaluate what would best work for their organizations. Managers can also provide the healthcare workers with compensation to help alleviate some of the pressures from the stressful job environment. Healthcare workers can use this information to notice the signs of burnout and become aware of the various reasons healthcare professionals leave the workplace. Awareness is the first step in making a difference. By knowing what to expect, the healthcare workers can better prepare themselves for the mental and physical toll the job takes. Additionally, by being aware of the different compensation and benefits available for healthcare workers, nurses can negotiate and unionize to demand better treatment in exchange for their services. Jens Hoeveld examines the causes and effects of short staffing in nursing in the article How Staffing Shortages Affect Patient Safety in Healthcare and Nursing. Hoeveld credits COVID-19 burnouts, a worrying shortage of nursing students, and a growing number of nurses who are at or near retirement age as reasons for short staffing in nursing. Other roles in healthcare are also experiencing staffing problems due to similar situations. Hoeveld examined how a shortage of employees to complete the same amount of work can lead to the work lasting longer and the quality of the work diminishing greatly. The article included several studies with data showing how detrimental short staffing can be. For example, the New England Journal of Medicine found that staffing registered nurses below target levels was associated with increased mortality. Additionally, the European Journal of Cardiovascular Nursing found striking links between nurse staffing levels on patient outcomes. Higher staffing levels reduced mortality, medication errors, ulcers, restraint use, infections, and pneumonia. The same study also found that greater aspirin use in more patients receiving percutaneous coronary intervention within 90 minutes was a result of higher staffing. Nightingale College released an article titled, Is There a Nursing Shortage in the U.S.? Statistics by State. Focuses on the data proving there is a nursing shortage, the reasons why there is a shortage, and the impact this shortage has. The projected nursing shortage in non-metro areas is projected to be higher in comparison to metro areas. Rural areas are much more likely to experience short staffing, and with rural areas having a higher amount of older residents, these areas tend to be severely underserved. New nurses also tend to migrate towards metropolitan areas, which further worsens the gap seen in rural areas for nurses. The article explained that one factor contributing to the nursing shortage includes a lack of students enrolling in nursing school. Demographically, nurses also tend to be over 86% women, and women will generally cut back or leave their workplace during childbearing periods. There is also a much greater demand for nurses as the aging population has nearly doubled from 1973 to 2023. The 65 and older age group is projected to increase faster than any other age group from 2024 to 2054. John Brazier and others reported an examination of staffing shortages at U.S. nursing homes during the COVID-19 pandemic that 3 common themes were found during their study of the experiences of 40 nursing home administrative staff members. The first theme is the shortage of staff during the pandemic. The nursing home staff were contracting the infection themselves. Becoming ill was causing the nursing home staff to miss work for lengths of time in order to regain their personal health and be compliant with guidelines. In order to combat the extreme short staffing, the administrative staff turned to agency staff, which was the second theme. Agency staff, while able to fill the staff shortages, often provided subpar care at a much higher cost to the nursing home. Agency staff was able to require such high pay because the demand for able-bodied workers was extremely high due to the short staffing. Theme 1 and Theme 2 had a combined effect of the nursing homes being unable to elevate the number of residents in their care, which was Theme 3. As a result of such low staff numbers, administration was not able to allow the nursing homes to take on any more residents in order to keep the residents from being placed at risk. Brazier and others discuss how the nursing homes were able to stay open while experiencing less than ideal working conditions by using solutions that were not necessarily optimal. Hiring agency staff reportedly caused a negative work environment amongst the staff who were already employed by the nursing home. This can largely be seen because of the group pay disparities while having similar responsibilities. Agency staff were seen as a temporary fix because the financial aspect of the situation was unattainable. Additionally, there was a trend among the managers to reduce the capacity at which they operated the nursing homes, while also increasing the patient-to-staff ratios. These factors combined to increase staff burnout due to the stress from working with temporary staff and having more responsibilities and patients at once. Although the nursing homes were able to stay open because of the various efforts by staff and administration, the quality of care tended to diminish due to the overwhelming nature the pandemic put on an already delicate healthcare system. Tanya Shivani-Knapp found that healthcare systems are struggling across the nation to ensure patient safety by hiring and retaining staff and decreasing the turnover rate among nurses in her article, The Staffing Shortage Pandemic. Shivani-Knapp attributed the shortage of nursing staff to a combination of events, from the retiring of older nurses, nurses leaving the profession in what is now known as the Great Resignation, and pandemic burnout and fatigue. This already present shortage of nurses was compounded with the resurgence of COVID-19 and its more easily transmissible variant. The remaining nurses were enduring undesirable work conditions while facing the threat of potentially getting sick themselves. In order to combat the issue of being understaffed, healthcare administration had to implement both short-term and long-term solutions. Some short-term solutions include travel nurses or nurses assigned by placement agencies. This can also include per diem nurses. While these short-term solutions are not bad themselves, an issue is the overuse of these resources that can negatively affect the healthcare system. These solutions were designed to be used in times when the patient census is higher than the hospital can manage. However, the COVID-19 pandemic has led to consistently higher patient volumes than the hospitals can adequately serve. In order to properly meet the needs of the patients, a higher demand for nurses arises, which in turn allows nurses to demand higher compensation and pay. This higher compensation, while deserved, is not financially sustainable in comparison to the to the financial cost of hiring nurses before the pandemic. This compensation for the nurses who are still working can include bonuses, incentive payments that are hourly, and overtime rates. The great need for long-term solutions was expressed. Some systems are implementing a travel agency program for their nurses to stay within their agency while also meeting the needs of different hospitals. Others are attempting to reduce competition by better recruiting their nursing staff. The option of international nurses is also explored. Nurses from Mexico and Canada are able to work in the United States as long as they have a nursing license, a specific visa, a passing NCLEX score, and they have met the requirements to become licensed within the state they plan to work in. The switch to 8 to 10-hour shifts is also evaluated as a solution to offer nurses a better work and life balance than the typical 12-hour shift provides. Overall, the article, The Staffing Shortage Pandemic, heavily focuses on addressing the ways that certain healthcare organizations have successfully and unsuccessfully managed the short staffing issues in healthcare. Practical solutions that work for the nurses, the administration, and ultimately the patients are explored. Paul Neiman and Tammy Neiman address how the shortage of nurses affects healthcare as a whole and the individuals in healthcare in the article, Nurses on the Outside, Problems on the Inside. The duty of nurses to support unions. The article also addresses nurses should use unions to combat short staffing. The authors include the International Council of Nurses' stance on the issue. The root cause of the increasing number of nurses' strikes is a global shortage of nurses, which is putting unsustainable pressure on the nurses currently working in healthcare systems that have been disrupted by staff shortages. The COVID-19 pandemic and historical chronic underfunding. Through contract negotiations, public pressure, and strikes, nurses' unions increasingly aim to sustain and improve the ability of communities to provide health care by addressing the problems of chronic short staffing and burnout. Nurses are using strikes not only for their own personal benefit, but for the safety of their patients and the better care that their patients deserve. Around the world, large nursing strikes were taking place during the pandemic in hopes of seeking better working conditions. Nurses in the United States, Brazil, Argentina, United Kingdom, and South Korea have participated in strikes to gain access to better pay, to personal protective equipment during the COVID-19 pandemic, to better compensation for COVID-19 exposure, and to better staff-to-patient ratios. The authors name one of the largest themes among nurses leaving the profession as burnout. According to Smiley's 2022 survey of the United States nursing workforce, approximately 56.7% of 238,535 nurses in the survey reported feeling used up at the end of the workday at least a few times a week, while 45.2% of the nurses in the survey felt burned out from work at least a few times per week. 3 conditions that heavily affect how nurses feel and perceive their job satisfaction to the point of considering leaving the healthcare field were inadequate compensation, feeling unappreciated by the organization they are employed by, and subpar staffing. Nursing unions are credited with improving conditions for the nurses and patients alike. Union benefits of higher wages, paid sick time, and adequate nurse-to-patient ratios are associated with lower turnover and increased recruitment and retention. The goals of unions are to improve the nursing environment and thus the type of care the patients receive. Becca Shaw and others explore the causes for nurses, listing burnout as a reason for leaving the profession in the article, Prevalence of and Factors Associated with Nurse Burnout in the United States. The authors credit burnout to be a significant issue among nurses in the United States who have either left their job or are considering leaving their job. The authors conducted a survey among 50,273 nurses who were predominantly white and female. 31.5% of the nurses who left their job in 2017 credited burnout as their reason for leaving. Additionally, nurses who worked more than 40-hour work weeks had a higher likelihood identifying burnout as a reason they left their jobs when compared to the nurses who worked less than 20-hour work weeks. Burnout in nurses is associated with poor staffing ratios, lack of communication between physicians and nurses, and lack of organizational leadership within working environments for nurses. Short staffing in healthcare can have detrimental effects on the work environment. Short staffing can lead to burnt out and overworked staff who are fatigued, which ultimately leads to compromised patient care. By taking measures to provide healthcare organizations with the proper amount of staff and compensation, the staff, management, and patients can have a better overall experience. These are the references I used for the paper. Thank you so much for listening. I hope you've enjoyed learning more about short staffing in healthcare.